she asked her anesthesiologist to record the intubation process. At first, they placed this mask on her, feeding her 100% oxygen. And the idea is to get her saturation level to 100% before they put the breathing tube in. You can see at the top of the screen there's a white syringe. It's filled with a medication called propofol. This is the medication that's responsible for putting the patient to sleep. And once they're asleep, this patient was also given a paralytic medication. This will relax the entire body. And for a brief moment in time, the patient is not getting any oxygen whatsoever, which is why it's so necessary to pre-oxygenate the patient to 100%. At which point the anesthesiologist will introduce the laryngoscope. The laryngoscope is designed to push the tongue out of the way and to visualize the vocal folds. You can see the folds right over there in that view. The gap in between is the trachea, and so the endotracheal tube will pass in between the folds. Once in place, the tube will then be connected to a circuit. The circuit will then be connected to a ventilator machine which will breathe for the patient during surgery. And the tube is then secured in place using tape. And that tube will stay in for the entirety of the surgery. Sometimes it can stay in even after surgery is done.